Go.
Hi, my name is Paulina McIntosh. I'm going to be your nurse today, and I'm going to be performing a head-to-toe physical assessment. I'm going to start off with orientation. So can I have your name, please?
Nikita Bell,
And the location you're in?
the clinic,
And what day is it today?
July 10th,
Okay, and about what time is it?
4 p.m.
Okay. And I'm going to have you count forward by 7, starting at 0. Just do some simple addition. Go ahead for me.
0, 7, 14, 21, 28, 35.
Okay, that's good. All right, now I'm also going to assess your skin, your hair, and your nails. Looking at your hair, it's evenly distributed, looks clean, not many split ends, no flakiness shown. Now looking at your skin, evenly toned. I don't see any rashes, no lesions or bruising noted. I'm going to go ahead and test for temperature. Nice warm skin throughout. Now I'm going to go ahead and test for texture. All right, nice smooth skin and elasticity. Testing for turgor. Very good. I also note that her color is appropriate for her race. Going to your nails, go ahead and stick your nails out for me. They're clean cut, pink in color, nice short nails. I don't see any cracking around the nail palette. Cuticles look intact, same with the toes. No cracking, cuticles look intact, pink in color. I'm going to test for cap refill. Less than 3 seconds, testing on your toes. Less than 3 seconds. I'm going to put some hand sanitizer on there. All right, and now I'm going to go ahead and test for clubbing. Go ahead and put your fingers together like a heart. Hold it up to me. All right, good. I'm just looking if there's any clubbing, and she doesn't have any clubbing. So now I'm going to test your head and your scalp. Gonna feel your head there. Any tenderness?
No tenderness.
Okay, very good. And I don't feel any lumps, no nodules there. I'm going to go ahead and test your frontal and your maxillary sinuses. Any pain or pressure?
No.
Pain or pressure?
No.
Okay, good. Go ahead and clench your cheeks. I was just testing the strength of your masseter muscle. And I'm going to test your temporomandibular joint. Go ahead and open, close, open again, close. Very good. No clicking noted. I'm going to test your head. This is what a cotton ball feels like. Close your eyes, and I want you to say yes when you feel it on your head.
Yes, 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 yes.
Very good. Now I want to go ahead and test your facial muscles there. Go ahead and smile for me. Frown. Scrunch up your nose. Good. Lift up your eyebrows. Puff up your cheeks with air. Don't let me push it out. And blow like a whistle. Okay, very good. Now I'm going to go ahead and test your, look at your neck here. Neck looks like there's no jugular, no vein distension. I'm going to test and see your trachea is midline. I'm going to do what's called a tracheal tug. You're going to feel me tug on your trachea a little bit. And I don't feel any pulsations noted. I'm going to have you turn your head to the left, turn your head to the right, and shrug your shoulders. Now go ahead and turn your head to the left again. Try and turn towards me. Very good. Turn your head. Try and turn. Good. And shrug your shoulders one more time. Very good. All right. I'm going to test your eyes, your ears, your nose, and your mouth. Okay? So testing for your eyes. I'm looking at the, sorry, I'm just trying to make sure the light you can see. I'm looking at the even distribution of the hair around the eyebrows. I'm looking at the eyelashes. I'm looking at the sclera, the iris, and the conjunctiva. Look up for me. Very good. Sorry, that hurts. If that hurts a little, look down for me. Very good. All right. Now I'm going to go ahead and use my Rosenbaum card. I'm going to test your vision. So with this, I want you to hold it about 12 inches away from your face. And you're going to cover one eye, and then you're going to read the lowest line you can read out loud.
4, 2, 8, 7, 3, 9, 20, 20.
Okay. Now go ahead and do the same thing with your other side there.
4, 2, 8, 7, 3, 9, 20, 20.
Okay, great. And do you wear glasses?
No, I don't.
Okay, so that would be your baseline. All right, now I'm going to go ahead and do what's called a confrontation test. So cover one of your eyes. I'm gonna cover the same eye, and you're gonna say yes when you see my fingers enter your field of vision, okay?
Yes. 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 Yes.
Okay, opposite eye.
Yes. 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 Yes.
Okay, great. Very good. Now I'm going to do some light reflexes. I'm going to do direct light. I'm going to shine a light directly into your eye. Very good. And her pupil is constricting. Now I'm going to do some consensual light. Very good. And we're going to do the same thing opposite eye. Very good. Pupil is constricting. Very good. And I'm going to shine my light here at the top of the bridge of your nose. Just check. All right. Now I'm going to go ahead and do some coordination. Look at my pen light and don't move your head. Only your eyes. Very good. Only your eyes. Very good. Okay. Now I'm going to, one more time, look for lid lag. Look up. Okay, and I'm just going to do the side again. Okay, very good. And then now I'm going to do some accommodation. So I want you to look behind me at the door there. Now look here. Very good. And again, I'm going to do it with the other side. Go look at the door there. Now look here. Very good. All right, so now I'm going to move on. We're going to go to your ears. I'm looking for any abnormalities, lesions, any foreign objects within the ears. I'm looking behind the ears. Let me look behind the ears there. Any pain or pressure when I touch?
No.
Okay. I'm going to stand about 3 feet away. Close your eyes, and I'm going to whisper something. Just repeat it.
A, B, C.
Okay.
1, 2, 3.
All right, great. Now I'm going to test the Weber's test. So what I'm going to do is I'm going to bang my tuning fork and I'll put it at the top of your head. You tell me yes if you can feel the vibrations.
Yes.
Okay, great. I'm going to do the same thing, but it's going to be on the sides of your, right behind your ear, and you should be able to feel and hear vibrations. And then once you stop hearing it, you say stop.
Okay.
Okay, and then I'm going to move it towards the inside of your ear, and you tell me once you stop hearing the sound, okay?
Okay.
Do you understand?
I do.
Okay.
Stop. Stop.
Okay, good. That was a long one. We're going to go ahead and do the other side.
Stop. Stop.
Okay. That took a little while there. All right, now we're going to go ahead and move on to your nose. So I'm just looking at the nose for symmetry. I'm looking for any nasal deviation. I'm going to look in the nose, looking at the mucous membranes in there, nice and pink. No bleeding, no obstruction, no lesions noted. I'm going to feel any pain here when I feel?
No.
Okay. And no bony prominence is noted. She has a nice smooth nasal bridge. I'm going to look at her mouth, looking around for any lesions, any open sores, any cracks, dryness on her lips. They're well moisturized. I'm going to look in her mouth, open mouth, looking at her buccal mucosa. Go ahead and open them all the way, okay. And I'm looking at the teeth for any cavities. I'm looking for any lesions, any redness or swelling, any discoloration. Now I'm going to go ahead and look in the back of your throat there. Say ah. Ah. Okay, very good. Now I'm also gonna, it's gonna feel a little weird. I need to put on some gloves for this. But I'm gonna grab your tongue with a gauze and I'm gonna look for any lesions at the base of your tongue, okay?
Okay.
All right. Go ahead and stick your tongue out. Open wider. Good. Good, okay. And then go ahead and stick your tongue out and move it from side to side. Okay, good. So we did the mouth, the ears, the nose, and the eyes. Now we're gonna move on down. I'll take my gloves off, use some hand sanitizer. We're gonna move on down to your chest. So go ahead and take off your shirt. All right, so just upon inspection, I'm going to be looking for any abnormalities, any rashes, any bruising. I'm going to be looking for the ease of breathing, her work of breathing, which is she doesn't seem distressed. I'm looking for chest rise, chest fall. I'm looking for her respiratory rate. I'm going to go ahead and look at her AP diameter, and it's less than her transverse. I'm going ahead to look at her. Well, that will be it. If I did see any abnormalities or hear any abnormalities, I would go ahead and perform a agophony, bronchophony, and whisper pectriloquy. Whisper pectriloquy. I'm going ahead to palpate. Let's palpate next. Tell me if you feel any pain,
No pain.
any discomfort.
No.
Okay, and then I'm going to percuss. We get under here. Good. Okay, great, thanks. Now I'm going to go ahead and listen using the Greek key pattern. Deep breath. Okay. Deep breath. Okay. Deep breath. Okay. Deep breath. Okay. And then I'm going to listen to the lateral sides. Go ahead. Okay. All right, very good. Now I'm going to turn it over and listen with my bell. Same thing. Okay. Okay. Okay, underneath here. Good. Okay, very good. Now I'm going to have you turn around, just swing your legs there so we can do the same thing on the back. Just be careful. All right. So now I'm looking the same thing, looking for any abnormalities. She's got a little skin peeling here. Were you in the sun at all?
I was at the beach.
Okay. So next time make sure you want to use some sunblock. I'm looking for any rashes, any abnormal bony prominences sticking out. I'm still looking at her ease of breathing. I'm going to go ahead and palpate. Any pain?
No pain.
That's on the scalp. Okay, and then I'm going to go ahead and percuss. Okay, very good, and then I'm going to listen. Deep breath. Okay, deep breath. Okay, deep breath. Okay, again. Okay, again. All right, one more time. Okay, good, and I'm going to listen with the back side too. Deep breath. Okay, again. All right, again. Okay. Again. All right. Last 2 times. Again. Okay. And again. All right. Okay. Now I'm going to have you lie down. All right. So now I'm going to assess the heart. I'm looking for any heaves, any thrills. I'm looking for any abnormalities, any bruising. I'm going to palpate for those stuffs as well. I'm feeling for any thrills. I'm looking for any heaves. And I'm feeling the point of maximal impulse here. I feel a good heartbeat there. So now when I go ahead and auscultate, I'm listening for S1 and S2, which can be distinguished by S1, the closure of the atrioventricular valves, and S2, the closure of the semilunar valves. If I were to hear anything abnormal, I'd have the client sit up so that it brings the heart close to the chest wall or lie on her lateral side. So now I'm going to go ahead and listen here. We're listening for the 5 areas: aortic, pulmonic, Erb's point, tricuspid, and mitral. Aortic is the second intercostal space at the right sternal border. Pulmonic is the second intercostal space at the left sternal border. Erb's point is the third intercostal space at the left sternal border. Tricuspid is the fourth intercostal space at the left sternal border, and the mitral is the fifth intercostal space at the left midclavicular line. So I'm going to go ahead and listen for those with my diaphragm and my bell. And now with my bell here. Okay, very good. All right, so now I'm going to go ahead and actually listen for the temporal artery, carotids, and then I'm going to feel for the rest of her arteries there. Okay. Good. I'm going to feel for the arteries now. The carotids, I'm going to feel one at a time. Okay, I'm going to feel the brachial arteries. Go ahead and put your hands on your side there. And the radials on both sides here. Now I'm feeling for the popliteal. Can you bend your knee just a little bit? Okay, good. Bend your knee just a little bit. Okay, good. The posttibials I'll feel on the inside here, and then the pedal pulses. Very good. All right, now I'm going to go ahead and do the abdomen since we have her lying here. I'm going to inspect. The contour is symmetrical. I don't see any protrusions. I don't see any bruising around the umbilicus. There's no lesions. I can't really see any visible peristalsis. And I'm going to go ahead and auscultate next. All right, and I do hear vowel sounds in all 4 quadrants. I'm going to lightly palpate. Any pain?
No pain.
Any pain?
No pain.
Okay, and then now I'm going to do a little deeper deeper palpation, okay? Any pain?
No pain.
How about now?
No.
Any pain now?
No pain.
What about now?
No pain.
Okay, now I'm going to feel for the kidneys and the liver. I want you to go ahead and take a deep breath. All right, and I'm going to go around the other side here. Go ahead and take a deep breath. Feeling for the kidneys. All right, and now I'm going to feel for the liver. Go ahead and take a deep breath. Okay, can't really feel the liver here, but that's normal on a person that doesn't have an enlarged liver. All right, now I'm going to have you sit back up. Go ahead and sit up and turn back around for one moment. Let me go ahead and so they can see your thoracic expansion. Take a deep breath. Okay. Again. Okay. All right, and then I'm also going to test the CVA for pain. Go ahead. Any pain?
No pain.
Any pain?
No pain.
Okay. You can flip back on this side. Thank you. All right, so now we're going to test your joints here. I want you to go ahead and put your neck down. Hyperextend your neck, head all the way back. Neutral position, ear to shoulder, ear to shoulder. Okay, and then look that way. Turn towards me. Good, look that way. Turn towards me. Good. And I'm going to try to push your head back. Don't let me push your head back. Don't let me pull it forward. Very good. I'm also going to, since you're in a sitting position, I'm going to just nudge you. Try not to let me push you back. Okay, very good. Now going down to the shoulders, I'm going to have you do this for me. Go ahead and cross your arms over your head. Very good. Now cross your arms in front of you. Very good. Stick your arms out wide. Don't let me push them down. Don't let me pull them up. Very good. Now go ahead and flex your arms, your elbows there. Extend. Open your hands. Turn them over. All right, very good. Now extend or flex back again. Don't let me pull you. Don't let me push you. Very good. Extend your hands. Go ahead and drop your hands up towards the sky. Neutral. Close your hands. Open. And okay, very good. And then grab my hands here. Very good. All right, now we're going to test your knees. Extend one of them. Okay, bend, extend, bend. Okay, try to push me out, push towards my hands. Good. Don't let me pull. Good. Now for your ankles, go ahead and push down like a gas pedal, up towards the sky. Don't let me push them down. Don't let me pull them up. Ugh, good. Very good. All right, so now touch your soles of your feet together. Very good. And try to touch the top of your feet together. I know it's okay. And not many people can do it, and you're not supposed to be able to do it that well. So, okay, so we did inversion, eversion. All right, and now I'm going to have you lie down one more time. We're going to do your hips. Okay, so go ahead and put your leg out to the side. Okay, now across your chin, all the way across your body. Okay, very good. Same thing with your other leg, out to the side, across your body. Very good. Flat. Bring your knee to your chest one at a time. Very good. Other side. Very good. Okay, now we can sit up. This way. Okay, now I'm going to close your eyes. I'm going to test some stereognosis. I'm going to go ahead and open your hands there. Can you tell me what this is?
Coin.
Okay, go ahead and tell me what that is.
A key.
Okay, very good. Now I'm going to go ahead and open your palms. Open your palms. I'm going to draw a number in your hand, okay?
4. 4.
Okay, very good. And now I'm going to go ahead, since you're sitting in this position, I'm going to test your sensation. Close your eyes for me and you say yes when you feel the cotton ball.
Yes, 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 yes.
Okay, very good. Now I'm going to go ahead and test your joint position. So this is going to be up, this is going to be down, and this is going to be neutral, okay? Put both your hands out. Okay, close your eyes.
Up, down, neutral, down, down, up, neutral.
Very good. I'm going to use some hand sanitizer there. All right. So now I'm going to go ahead and test your vibrations all over your body. So I just want you to say yes when you can feel the vibrations. Go ahead and close your eyes.
Yes, 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 yes.
Okay, very good. And now I'm going to do some light, some superficial pain, okay? So this is going to be sharp pain, and this is going to be dull pain, okay? So close your eyes. Tell me which
Sharp,
one.
sharp, dull, dull, sharp, 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 dull, dull.
Very good. Okay, and now last but not least, we're going to have you do some walking movements. So stand up for me. Do you need to hold on to anything? Okay, let me move this table just a little bit. All right, so I want you to come this way, or I'm sorry, come this way and walk towards me. Let me see your gait here. Okay, turn around. Walk heel. We're going to do what's called a tandem, so you're going to walk the line like you're doing a tandem. Very good, very good. Turn around. All right, now you're going to walk on your heels towards me. Very good, and then you're going to turn around and walk on your toes. Okay, very good. All right, you can sit back down. Okay. Oh, before you sit down, go ahead and we're going to reach towards our toes. Okay, and go ahead and stand up. Now lean back as far as you can. Okay, good. I don't want you to fall there. Now go ahead and side bend, lateral bend, other side, lateral bend. Okay, and now we're gonna rotate just your top half. All right, other side. Very good. Sit back down. Okay, you good? Are you okay? Okay. Now I'm gonna test for your thyroids and your lymph nodes. Go ahead and take a sip of water, just hold in your mouth. I'll tell you when to swallow. Put your head towards me. Swallow. Okay, very good. Go ahead. All right. Turn your head that way. Swallow. Very good. And I did feel +1 on both sides. And then I'm going to go ahead and test your lymph nodes, your 9 areas. So we have the back here, the occipital. We have back behind the ears. Any pain while I'm touching that?
No.
In front of the ears. You tell me if you feel any pain.
Okay.
Underneath the chin, the back of the neck here. And we're going to do the front of the neck one at a time. And then the sternal border. Okay. And I believe that concludes the exam. I'm going to take 5 minutes to look at my notes and then I'll be right back.